Analysis and test results. Ayurveda. A special algorithm is used to interpret the results, according to the concept of Ayurveda. This algorithm is based on Dr. Porges' polyvagal theory, on the evolutionary theory of the vagus nerve. The polyvagal theory allows us to translate the results of the classical HRV test into Ayurvedic concepts and terms. Dr. Porges' research led to the conclusion that the autonomic nervous system, which affects the functioning of the heart, consists of three parts. The first is the sympathetic adrenal system, which activates the fight or flight adaptation mechanism in conditions of danger and stress, or the move actively play mechanism in an active state in the absence of great stress. The second system is the dorsal branch of the vagus nerve, which autonomously turns on the adaptive mechanism, freeze, pretend to be dead, in a situation of mortal danger, or the conditioned mechanism, do not move, digest food, in the absence of danger. The third system is the ventral branch of the vagus nerve, which activates the adaptive mechanism, befriend, communicate, help, regardless of the presence or absence of an external threat. Based on the polyvagal theory and studies of the conduction of nerve fibers, it can be concluded that there is a certain relationship between the frequency ranges, as well as the amplitudes of the heartbeat, with the activation of the branches of the vagus nerve, and also with the effect on the heart of the sympathetic nervous system. The dorsal, unmyelinated part of the vagus nerve is made up of thick fibers and is capable of conducting impulses at a very low frequency. The ventral, myelinated portion of the mammalian vagus nerve is capable of conducting rapidly changing impulses. Spectral analysis of the graph of changes in cardio intervals allows us to conclude that the different frequency ranges of the heart work with different degrees of influence of individual parts of the autonomic nervous system. The frequency spectrum of changes in cardio intervals can be represented as a result of the influence of the sympathetic nervous system and two separate branches of the parasympathetic nervous system. The very low frequency range, when slowly changing amplitude waves are present in the rhythmogram, presumably corresponds to the influence of the dorsal branches of the vagus nerve. With the predominance of these frequencies, cardio intervals change very slowly, the heart works very rhythmically and does not correspond to the normal healthy adaptive changing work of the heart. With a lot of danger stress, the heart can stop and the frequency of contractions becomes low. This corresponds to a state of torpor and immobility. The amplitude of cardiac output in the blood decreases. A long stay in this state is dangerous for a person. The low frequency range, when faster waves of rhythmogram change are most pronounced, corresponds to the state under the activating action of the sympathetic nervous system. In the high frequency range, the rhythmogram is saturated with rapidly changing waves. This corresponds to the influence of the ventral branch of the vagus nerve. Next, we will consider the issue of transition from the results of the study of heart rate variability using the polyvagal theory to some concepts of Ayurveda, in particular, to the concept of gunas. Gunas is one of the main concepts in Ayurveda. In Ayurvedic philosophy, the gunas are three qualities that are present in all things and govern their characteristics and qualities. The three gunas are sattva, purity, balance, and harmony, rajas, activity, passion, and movement, and tamas, darkness, dullness, and inertia. It is believed that maintaining a balance of the three gunas is essential for overall health and well-being. Each individual has a unique balance of the three gunas, and this balance can be influenced by diet, lifestyle, and environment. In Ayurveda, the goal is to cultivate a balance of the gunas that is conducive to good health and well-being. The results of the spectral analysis of pulse waves, considered through the prism of the polyvagal theory, allow us to conclude that each of the three frequency ranges corresponds to its own degree of activity of each part of the autonomic nervous system. This predetermines the adaptive behavioral state of a person, which in turn is very close to the concept of guna in Ayurveda. This allows us, with some confidence, to calculate the ratio of balance in the body and look at the frequency distribution circle from a new angle. From this point of view, the influence of the dorsal branch of the vagus reflects the manifestation of the tamas guna. The low-frequency sector corresponding to the activity of the sympathetic adrenal system reflects the manifestations of the rajas guna. The influence of the ventral branch of the vagus nerve reflects the manifestations of the sattva guna. The size of the sector in the pie chart shows the degree of manifestation of each of the gunas. Further, having an idea of the physical degree of manifestation of each of the three gunas, one can proceed to the concepts of the three doshas of a person as a complex of energy substances. The Life Pulse Pro algorithm uses the results of the HRV test to quantify the manifestation of doshas as well as other parameters expressed in Ayurvedic terms. In Ayurveda, the three doshas are the three fundamental principles that govern the functions of the body and mind. These doshas are Vata, Pitta, and Kapha. Vata is associated with movement and governs processes such as breathing, circulation, and muscle and joint movement. It is said to be composed of the elements of air and space. Pitta is associated with transformation and metabolism and governs processes such as digestion, absorption, and metabolism. It is said to be composed of the elements of fire and water. Kapha is associated with structure and lubrication and governs processes such as growth, lubrication, and stability. It is said to be composed of the elements of earth and water. According to Ayurveda, each individual has a unique balance of the three doshas, and imbalances in the doshas can lead to physical and emotional health issues. Next, consider an example of using the Ayurveda tab. To do this, click the Ayurveda button. This activates the Ayurveda module. Control buttons are located at the top of the screen. Clicking on these buttons allows us to get more detailed information. Gunas tab. This shows the degree of manifestation of gunas and their ratio in the body. In addition, the normalized value of each of the gunas is displayed. Information about the three doshas is presented here. We see a significant imbalance of Vata dosha. In Ayurveda, the sub-doshas are smaller, more specific energies that function within the larger doshas. Sub-doshas are responsible for specific body function and are influenced by larger doshas. Here are the 5 sub-doshas for each dosha. In this case, the patient has problems with the respiratory system. He is in a state of acute respiratory illness. The state diagram of 5 conditional elements of the body is presented in this tab. Each element is associated with certain characteristics and qualities. Chakras. The activity of conditional energy centers in the human body is presented here. The degrees of manifestation of the substances Ama and Agni are shown on these 2 scales. The energy state of the whole organism, or aura, is conditionally shown in this figure. An analytical diagnostic system can offer some recommendations. For example, mudras. Such mudras use is advisable to reduce the dosha of Vata. Manifestation activity in the main functional systems, meridians, is also determined. At the same time, one can see both the activity of the systems themselves and the activity of the external functions of the meridians. In this case, we see excessive activity of the lung and large intestine meridians. Other information as well as recommendations are available through the corresponding menu items.